And welcome to another episode. Well, you know that October is Breast Cancer Awareness Month, right? Many women schedule annual mammograms, right, as a result of the national spotlight on breast health and breast cancer risk. But it's a fact that nearly 30% of women do not feel informed about how their breast density impacts their breast cancer risk and screening needs. So, what is breast density? And how does it impact breast cancer risk? Well, we've got an expert to answer those questions and more on this very serious topic. And I'm referring to Dr. Pamela Habib, who's head of the U.S. Medical Affairs, Bayer Radiology. Welcome, Doctor.
Thank you, Mark.
You know, to a layman, what is breast density and how does it impact breast cancer risk?
That is a great question. So breast density is something that we identify on a mammogram. A lot of women think that they can feel their breasts and identify whether or not they have dense breasts, but we really only know once they have a mammogram. And then on that mammogram, we can see what we call fatty tissue and what we call dense tissue. Dense tissue consists of fibroglandular tissue in the breast. And the reason why it's important is because this dense tissue appears white on the mammogram. However, cancers also appear white. So you can imagine that a woman with extremely dense tissue that has a lot of white tissue all over the breast, it can be very difficult to find a tiny little cancer hidden in there. Additionally, so that's one factor, but it's actually a twofold risk because another factor is that women with extremely dense breasts have an underlying increased risk of developing breast cancer. So numerically, the woman with the most extremely dense breasts in that category, they are 3 to 4 times more likely to develop breast cancer in their lifetime compared to a woman with the least dense breast. So because of these two factors, making the mammogram more difficult to identify cancers and also causing an underlying increased risk, it's very important to be aware of whether or not you have dense breasts. But I do want to emphasize that it's a normal finding and it's very common. As you mentioned, nearly half of women age 40 or over are told they have dense breasts. So it's not something that should cause immediate alarm the minute that someone might see that they have dense breasts, but it is a reason to have a conversation with your healthcare provider given the risks that I mentioned.
Well, it's another concern, so let me ask you this then. For women with dense breasts, are mammograms enough to detect breast cancer?
The mammograms continue to be the gold standard screening test. So it's been around the longest, we have the most data, and we know that mammograms save lives and decrease breast cancer mortality. However, it is true that they are more difficult to read in women with dense breasts. And in fact, mammograms can miss up to 40% of cancers in women with dense breasts.
Wow.
However, it doesn't mean that women should avoid the mammogram if they have dense breasts, because it's still the best tool to start with. Mammograms perform very well and identify cancers in women with dense breasts. It's just important that on top of that mammogram, it might make sense to have additional what's called supplemental screening to see if there can be additional cancers that may be identified. However, it's always important to start with that mammogram.
So is there a lot of missed underdiagnosed cancers, do you think? I mean, it sounds like it's a very intricate business, very difficult sometimes to be able to find from what you're saying.
There are definitely cancers that are missed. We hear lots of stories in the news every day about women who had a normal mammogram. However, their breasts were dense, and within a few months they had breast cancer identified either by feeling it or on a different test. So definitely there are cancers that are missed, cancers that are underdiagnosed, which is why we want to increase the awareness of this and just make women aware that a negative mammogram doesn't necessarily mean that they are completely cancer-free, particularly if they have dense breasts. They should have that conversation with their doctor to see if they might need additional screening.
Well, Dr. Habib, in this wonderful world of AI now and, increased IT and all this jazz, is there anything on the horizon for you, technically, machines or anything that are going to help you, do you think?
That's a great question. There are lots of tools being studied at the moment. Technology is always improving and always being researched. There are newer technologies that are being developed either faster or with better detection. And then, as you mentioned, AI or artificial intelligence is also being explored and developed to help detect additional cancers or help see things that maybe a radiologist is not able to see with the human eye. So I think there's a lot of potential and a lot more advanced technologies that we may see in the future, but it is continuously being researched and developed.
That's good. No, that's good. Geez, no fun being a woman, is it? I tell you what. Look, if a mammogram shows dense breasts, what questions then should a woman ask her healthcare provider?
That's a great question. I think there are a lot of questions that you can start with if your mammogram shows that you have dense breasts. And the first one is really just understanding how dense are my breasts and do I fall within a specific breast density category. After that, I think it's important to understand what it means for your personal breast cancer risk. So asking your healthcare provider, how does this impact my risk? And then sharing other risk factors. Your healthcare provider should ask you for additional risk factors, but it's important that you share them in the conversation as well. So family history, any known genetic mutations, anything that you can think of is important to share, because your healthcare provider can then take that information that you provided from your risk history, but then also take the mammogram information, take the density information, and come up with the best screening option for you and determine with you whether that means additional screening on top of your annual mammogram.
Right. So this is what they call the supplemental imaging, is it?
Exactly. It's supplemental screening, and it means an additional test on top of the annual mammogram. So as I mentioned, it's always important to start with that mammogram, but then additional screening may be beneficial after that.
Well, it may be October when we're recording this, but this will stay around for some time. The reality is it's not just an October issue, is it? It's a year-long thing that you're trying to get the message out there to women. Because, let me ask you this. Are women embarrassed to ask these questions and to go down this road?
I think there is a misconception and a lot of unknown information. So I don't know that it's necessarily an embarrassing topic, but I think without knowing enough about what you're asking or why it's even important, I think that might prevent some women from actually opening that conversation with their doctor. And that's why we'd like to get the word out in October, but then throughout the year, as you mentioned, because it's important every day. The more women that are aware of this concept and the importance of screening and the fact that dense breasts may increase the risk, the more they can have that discussion openly with their doctor and ask the right questions and provide the right information so that the doctor can come up with the right plan.
This, Dr. Habib, this particular site that we have, the densebreastresources.com, does that have a lot on it for women to be able to read and get a better handle on things?
It does. So that site has a lot of information on breast density and tips for talking with your healthcare provider about dense breasts and about breast cancer screening needs. So it's a great place to start to understand the concept of breast density and what you might be able to do if you find out that you have dense breasts.
That's good. That's good. So, folks, just write that down. Grab a pen. It's www. All one sentence, dense, DENSE, breast resources. RESOURCES, okay. I know you're not dumb, but breast resources, okay, .com. Fabulous, that's important. Knowledge is everything. Education is everything, isn't it, Dr. Pamela? She is head of the U.S. Medical Affairs at Bayer Radiology. October, of course, is Breast Cancer Awareness Month. Is there anything you'd like to add from a personal point of view, Doctor, before we go?
I think just the importance of getting screened on time. So I think it's very easy in this busy world of ours to delay our mammogram, delay any screening tests. But as I mentioned previously, screening saves lives, and it's very important to not delay when it's time for your annual screening, to make sure that you get that scheduled and get the test done, and not to put it off.
Fabulous. You do a great job. And it's lovely speaking with you again, Dr. Pamela Habib, right here on The Mark Bishop Show, head of U.S. Medical Affairs at Bayer Radiology. Keep in mind, October is Breast Cancer Awareness Month. Thank you, Doctor. Goodbye now.
Thank you, Mark.